Imagine waking up one day with a lump in your neck and facing a doctor who tells you it's thyroid cancer. It sounds frightening, doesn't it? Suddenly, terms like papillary and medullary are tossed around, and you're left wondering, what do they really mean? In this video, we're going to break down these two common types of thyroid cancer in a way that's easy to understand. If you or a loved one has ever been concerned about thyroid cancer, this is for you. Let's get started. What is papillary thyroid cancer? Papillary thyroid cancer is like the good news version of thyroid cancer. It's the most common type, accounting for around 80% of cases, and it generally grows slowly. It starts in the cells that make and release thyroid hormones, so it's known as a differentiated cancer. But what does that mean? Think of it as a cancer that's still pretty close to the original thyroid cell structure, which makes it easier for doctors to treat. Usually, papillary cancer forms in one lobe of the thyroid and often spreads to nearby lymph nodes. The good news? It's very treatable, and with early detection, it rarely spreads beyond the neck. In fact, with prompt treatment, papillary cancer is rarely fatal. Even if it does spread, modern treatment options can often bring it into remission. What about medullary thyroid cancer? Medullary thyroid cancer, on the other hand, is a bit of a different story. This type starts in the C cells of the thyroid, which produce a hormone called calcitonin. These C cells are less differentiated, meaning they're further from the typical thyroid cells. This makes medullary cancer a bit trickier to treat. Medullary thyroid cancer only affects about 4% of people with thyroid cancer, so it's far less common than papillary cancer. However, it's also more aggressive and can spread to other areas like the liver and lungs before it's even detected in the thyroid. This aggressive behavior means that medullary cancer can have a less favorable prognosis if it reaches an advanced stage. Prognosis and survival rates. Here's where things get interesting. Despite being more aggressive, medullary thyroid cancer has a fairly good prognosis when it's caught early. In the early stages, the survival rates for medullary and papillary cancers are similar. But, if medullary cancer has already spread to distant organs, it's harder to treat and can have lower survival rates compared to advanced papillary cancer. On the other hand, papillary cancer generally has a high survival rate, even if it has spread to lymph nodes nearby. The key here is early detection. If the cancer is localized, meaning it hasn't spread beyond the thyroid, both types of cancer have a favorable outlook. As the stage advances, papillary tends to maintain a better prognosis, especially if treatment begins promptly. Why do these cancers happen? So, why do people get thyroid cancer? The exact cause isn't always clear, but there are some common factors. Sometimes, changes in a person's DNA can lead to cancer. For some people, this is due to genetics. In fact, medullary thyroid cancer has a higher rate of familial cases compared to papillary cancer. About 15–30% of people with medullary cancer inherit a genetic predisposition. This is why some doctors may suggest genetic testing if there's a family history of medullary thyroid cancer. Other risk factors include exposure to radiation, particularly during childhood, iodine levels that are either too high or too low, and even obesity. In papillary cancer, around 5% of cases are linked to family history. Treatment options for papillary thyroid cancer. If you're dealing with papillary thyroid cancer, treatment options are well established and effective. The first step is usually surgery. Depending on the extent of the cancer, a doctor may recommend a total thyroidectomy, which is the removal of the entire thyroid, or a lobectomy, where only one lobe is removed. Following surgery, radioactive iodine therapy, RAI, is commonly used to target any remaining thyroid tissue or cancer cells. RAI is unique to differentiated thyroid cancers like papillary and follicular cancer. It works because thyroid cells absorb iodine, allowing the radioactive iodine to destroy any lingering cancerous tissue. Additionally, thyroid suppression therapy may be recommended to reduce the chances of cancer returning. This therapy involves medication that helps prevent the growth of thyroid cells by lowering certain hormone levels in the body. In some cases, external beam radiation therapy, EBRT, might also be used, particularly if the cancer is more advanced. Treatment options for medullary thyroid cancer. For medullary thyroid cancer, treatment often starts with surgery, similar to papillary cancer. However, because medullary cancer is more aggressive and doesn't respond to RAI, the treatment plan is different. After surgery, external beam radiation therapy, EBRT, may be used to target any remaining cancer cells. If the cancer has spread beyond the thyroid, targeted therapy may be an option. This involves medications that specifically target cancer cells based on certain genetic mutations. In advanced stages, palliative care might also be introduced to help manage symptoms and improve quality of life. Comparing papillary, medullary, and other types of thyroid cancer. It's worth mentioning that papillary and medullary thyroid cancers aren't the only types. Follicular thyroid cancer, for example, is another differentiated type that accounts for about 10% of cases. It usually doesn't spread to lymph nodes but can spread to other organs, such as bones or lungs. While follicular cancer has a good prognosis, it's typically not as favorable as papillary cancer. Anaplastic thyroid cancer is on the other end of the spectrum. It's undifferentiated, meaning the cells look completely different from normal thyroid cells. This makes it extremely aggressive and difficult to treat. Anaplastic cancer is rare, making up only about 2% of thyroid cancer cases, but it spreads rapidly and is hard to control. Key takeaways. So, what should you remember about papillary versus medullary thyroid cancer? 1. Papillary thyroid cancer is common and highly treatable, with a favorable outlook even if it spreads locally. 2. Medullary thyroid cancer is rarer and more aggressive. Its prognosis depends heavily on early detection, as it can spread before it's even discovered. 3. Genetic factors play a bigger role in medullary cancer than in papillary cancer. 4. Treatment options for both types of cancer typically involve surgery, but the approaches differ beyond that point due to the cancer's unique behaviors. In the end, both types of thyroid cancer have promising outcomes when detected early, so regular checkups and awareness are key. If you or someone you know is facing a thyroid cancer diagnosis, know that advances in medical treatment are improving survival rates every day. Thank you for watching. If you found this video helpful, be sure to like, subscribe, and hit the notification bell for more content that breaks down medical topics in a way that's easy to understand. Stay informed, and take control of your health.